Shared medical appointments are a new model of care. A shared medical appointment, often called an SMA, is a 90-minute visit in a group setting. This model uses a team-based approach led by a provider working with other members of the healthcare team. We believe these visits provide the right combination of individual attention and group support. This video, along with the Women's Medicine Collaborative Shared Medical Appointment Training Manual, will help guide your team in running a successful SMA. The facilitator of the shared medical appointment is sometimes referred to as the behaviorist. This role should be filled by a healthcare professional who is skilled at motivational interviewing, health coaching, or behavior modification. We find that registered dietitians, social workers, nurses, and trained health educators work well as the facilitator. The facilitator plays a key role in managing the group dynamics and engaging patients in the group experience. We find it valuable for the team to meet before the shared medical appointment to discuss general goals and objectives. It can also be helpful to agree on some general education topics to cover related to the health concern or common medical issue that is the focus of the particular shared medical appointment, also referred to as an SMA. It's important that the facilitator arrive at least 15 minutes prior to the start of the SMA to greet each patient as she enters the room and provide the patient packet and name tag. This is an appropriate time to explain what is in the patient packet. Ask the patient to review and sign the consent form and confidentiality statement, and ask if there are any concerns that the patient would like the provider to address at today's visit. These concerns should be written on a whiteboard that the provider can easily read. It is also helpful to ask each patient what is working well for them. For example, the facilitator in a diabetes SMA might ask, have they been able to lose weight? Have they been making healthier meal choices? Have they found time in their day for activity? Write these on the whiteboard as well. These achievements can serve as good talking points to help motivate others in the group. The facilitator starts the SMA on time with a brief 1 to 2 minute introduction. The team should be introduced and their roles explained. As well, general housekeeping items are covered, such as where bathrooms are located, silencing cell phones, and if snacks are available. Also, confidentiality should be discussed with the group at this time. Here is a sample introduction.
Welcome everyone to today's shared medical appointment. My name is Katie, and I'm one of the registered dietitians here at the Women's Medicine Collaborative. Before we get started, I'd like to go around the room to introduce our team. We have Dr. Miller, we have Gwen, who's going to be doing our documentation, and we have Pia, who's our medical assistant. She'll be taking your vital signs and writing any important information we'll need for this visit on the board behind me.
When there are breaks in the conversation, such as when the provider is reviewing the medical record with the documenter or examining a patient, the facilitator should generate group interaction. The conversation should be focused on something specific to the concerns of the patients attending the particular SMA and must include some discussion on goal setting and attainment. The successes of other patients are good discussion points to help the group learn through the strategies that others have used to help achieve their goals. The facilitator also handles any group dynamic issues. These may include keeping the provider on time. On average, the provider should spend 5 to 10 minutes with each patient. Managing patients who may try to dominate the conversation. Encouraging quiet patients to get more involved in the group discussion. And keeping the conversations brief and meaningful. The facilitator must try not to allow the shared medical appointment to become a support group. Use the goals and objectives established for the SMA as a guide to focus the discussion on the key points that you and the provider planned to address. As the group comes to an end, the facilitator should have a brief closing, thanking patients for selecting a shared medical appointment, offering a future SMA appointment, and explaining that patients always have the option of having an individual appointment with their provider as well. Ask the patients to complete a brief survey about their SMA experience before leaving. It is important to end the group on time. The medical assistant role should be filled by someone who has a formal training as a medical assistant. 1 week before the shared medical appointment, also called an SMA, the medical assistant reviews the electronic medical record of each patient scheduled to attend the SMA. This review includes gathering any recent lab or diagnostic test results and identifying the need for important screening tests or immunizations. All lab results pertinent to the SMA focus should be documented on the lab values grid. For example, in preparation for an SMA for diabetic patients, the provider will likely want to know each patient's most recent cholesterol levels, blood glucose, and hemoglobin A1C. 1 week before the SMA, the medical assistant contacts all scheduled patients by phone to confirm the appointment and to be sure the patient understands that they will be seen in a group setting. Explain where they are to check in, if different than the usual location they come to for their appointments. During this phone call, the medical assistant also reviews the patient's current medication list, allergies, and preferred pharmacy. Arrive at least 15 minutes prior to the SMA start to make sure the computer is up and running and each patient's electronic medical record, or EMR, is accessible. The medical assistant also sets up the workspace to include the supplies and equipment she will need. For example, a laptop computer, gloves, hand sanitizer, Sani wipes, blood pressure cuff, stethoscope, thermometer, pulse oximeter, and a stand-up scale. Prior to the start of the SMA, recent lab results should be written on the lab values board in the SMA room, identifying each patient by first name only. As the patients arrive, the medical assistant sees each patient individually, just like they would in a one-on-one appointment. Vital signs are assessed and entered into the lab values grid, into the EMR, and onto the lab values board. The provider may also ask for additional information to be noted on the lab values board, such as any change in weight, daily servings of fruits and vegetables, and minutes of activity or exercise per day. This information can be gathered during the vital signs assessment. It is very likely that the medical assistant will not be able to assess each patient's vital signs before the facilitator begins to speak to the group. Therefore, when patients who are seated in the group need their vital signs assessed, the medical assistant taps the shoulder of the next patient and directs her to the medical assistant's area to complete the vital signs. The patient then returns to the group. Once all patients have been assessed and their vitals and other pertinent information has been entered into the EMR and on the lab values board, the medical assistant can assist with printing lab order slips, booking a follow-up appointment, and printing educational handouts for patients. Any paperwork that should be filed in the patient's chart should be given to the documenter after the session to be scanned into the electronic medical record. The provider role should be filled by a physician, nurse practitioner, or physician's assistant. The provider should arrive on time and briefly welcome patients to the shared medical appointment. Once the facilitator completes the introduction, the provider immediately starts interacting with the first patient. Begin by acknowledging any specific concerns that were documented by the facilitator. Move then to a review of their vital signs and recent lab results that are noted on the lab values board. While reviewing this information, the provider can briefly educate the patient, as well as the rest of the group, about normal values and the significance of any abnormal results. The status of the patient's chronic conditions should be addressed as well. During this interaction with the patient, the documenter is recording the history of present illness, the HPI, in the patient's electronic medical record. The provider's discussion with a specific patient is a time when the provider may create opportunities for the group to interact as a whole. For example, if the first patient is worried about insomnia, the provider may ask if others in the group have experienced this symptom. Before the provider then moves to the patient to perform a brief physical exam, she may ask the facilitator to discuss some key points about managing insomnia. While the facilitator is speaking, the provider then moves to the seated patient to do a brief, focused physical exam. The physical exam is done in the group setting with patients fully dressed. If the patient requires a more private exam, a separate exam room is available nearby. Once the provider completes the physical exam, the facilitator wraps up their discussion and turns it back over to the provider. The provider then lets the patient know about any abnormal findings on the exam and explains the significance of these findings to the patient and to the group. The provider also makes recommendations to that patient for specific follow-up, such as tests or referrals. This workflow is then repeated with each individual patient. At the conclusion of the SMA, the provider reviews the notes with the documenter, with the goal of completing each note by the end of the shared medical appointment. The documenter role should be filled by someone with a thorough understanding of your electronic medical record, or EMR, an excellent understanding of medical terminology, and highly skilled at transcribing. The documenter should arrive at least 10 minutes prior to the start of the shared medical appointment, also referred to as an SMA. Make sure that the computer is working properly and that you have access to each patient's EMR. As the provider sees each patient, the provider should be sure to verbalize their findings and key points so that the documenter can capture the findings accurately in the patient's record. The documenter also documents the follow-up plan, any orders for lab tests, diagnostic tests, or medications, as well as the lifestyle goals set by the patient. It is important that the documenter and the provider meet to discuss and review the notes after the first several shared medical appointments. This review and provider feedback helps the documenter to understand the specifics of how the provider would like the patient notes written. Any paperwork, such as the confidentiality statement or review of systems, is to be scanned into the patient's electronic medical record after the session. This video, along with the Women's Medicine Collaborative Shared Medical Appointment Training Manual, provides your team with the necessary information to develop your own shared medical appointment program.